Good evening, you're watching NDTV with me, Rishika Barua. Over the course of the next half an hour, we will take your questions on the coronavirus. You can dial us on the number there on your screens. We'll be joined by a panel of expert doctors who will answer some of those questions. Let me begin by introducing Dr. Subhashish Ganguly. He is a consultant physician and specialist in critical care from the Apollo Hospital. He's joining us from Kolkata. We also have Dr. Rajiv Bhagwat. He's a consultant interventional cardiologist. He's attached to the Nanavati and Breach Candy hospitals in Mumbai. Appreciate both you doctors for being with us on the broadcast. I want to begin, Dr. Ganguly, if I could, with you to ask you, about this entire new theory on whether ventilators are actually effective and whether they should be used for coronavirus patients. There have been, conflicting studies, of course, some saying that ventilators actually prove to be disastrous for coronavirus patients, some saying that you can't blame the ventilator because patients who are put on ventilator support are presumably already in a critical stage.
Yeah, good evening, Rishika. You were right. Initially, it was thought that this novel coronavirus, after it infects a human being, after the transmission, after the increase in viral load, initially it starts with a flu or influenza-like symptoms, which progresses to the involvement of other organs. And it creates the main injury, what usually creates a critical situation is the injury to the lung. And initially it was thought that it could be due to a inflammatory reaction, which was an immunological reaction against the antigen of the virus, and there used to be a ARDS-like symptoms, which we have seen previously also in this sort of viral infections like SARS or MERS. ARDS means it's an acute respiratory distress syndrome. So initially, the ventilator was used in exactly the parameters, and the use of ventilators were exactly what we used to use in patients of ARDS. But the new theory which have emerged in last few weeks or days, that the main brunt of the disease is not the injury to the lung, but is on the RBC or the hemoglobin.
All right.
So, hello?
Yes, doctor, we can hear you. I'm going to come back to that issue, and I will also bring in Dr. Gupta into the conversation and, ask you some more questions related to ventilator support, because, it's extremely fascinating what some of the studies abroad have shown up, and you're in a certain sense concurring, with that point of view. But our first caller, Mariam from Hyderabad, is on the phone line. Go ahead, Mariam.
Good evening.
Yes, good evening.
I had asked a question on the show about the possibility of relapse and about herd immunity. I was told that vaccinating the population is one way to develop herd immunity. So my question is, given that there isn't a vaccine yet and that lockdowns cannot go on forever, what is the possible way ahead if at all there happens to be a relapse?
All right. Possible way ahead if there happens to be a relapse. Dr. Gupta, would you like to take that on?
Sorry, I was testing this. Yeah, I just have the question again, if you don't mind.
Dr. Gupta, could you hear the question? Do you want me to repeat it for you?
Yeah.
All right. I believe Dr. Bhagwat, I apologize, is on the line with us. Dr. Bhagwat, the question is very simply, in the absence of a vaccine, if somebody has a relapse, what happens?
So relapse has been reported from China of late, and they feel that relapse could be a reactivation of the virus. Can you hear me?
Yes, doctor, we can hear you.
Yeah, so could be a reactivation of the virus. So in the absence of a definitive treatment, if the virus is not fully extirpated from the body, then that is possible. If the host immunity is low, then that possibly is the reason for reactivation. Other possibilities that have been discussed from Europe and some parts of America is that the testing that was before discharge from the hospital, the patient was tested negative.
Right.
So that testing also has been questioned. Those kits, the standardization of kits, standard of kits like Netherlands, the Germany, England, they sent back kits from a particular country. So relapse needs a lot of research, and we are at the current moment not being able to find a proper definitive treatment. So relapse becomes even more difficult to treat.
Right, right. But in that case, I think what you're essentially saying is that building your immunity at this juncture is extremely important. Our next caller, Professor Vikram is on the phone line from Amritsar. Go ahead.
Yes, good evening.
Good evening, go ahead.
My question is that number one, that there is no vaccine invented so far to kill this virus, coronavirus. Number two, that whatever patients have recovered from this ailment is either due to their own immunity or due to some symptomatic drugs that they are being given. And therefore, the question is that and the third thing is that this virus, there is no, what you can say, relation between the change in the weather, like it was thought that hot weather will automatically kill the virus.
So if you could ask your question, please.
No evidence for that. So my question is that in view of these, can our medical experts give us some date that when we will be relieved of this ailment and this dreadful disease, and the virus will be killed?
All right.
Because I think that the virus is self-sustaining; it's continuing. So in the lockdowns that are being exercised, I think that they are fruitless. I think, that's
all right. We understand. We understood your question. Dr. Ganguly, would you want to take that on? I think there's a lot of anxiety over the road ahead. You know, what happens in the absence of there being no vaccination? We can't have endless lockdowns. I think a lot of anxiety over that.
So for me, possibly I can answer in, the first answer would be to find out the proper retroviral medications actually. So there are already studies are going on, maybe very specific retroviral therapy like rotenavir, lopinavir, if they start working, or the exact doses, or remdesivir. There are other works are going on with tocilizumab. So these medicines can help and can maybe eradicate this virus on a human being first. And secondly, regarding the vaccines, I can say that the trials and everything is going on, although few countries, they are claiming that the vaccine will come in within 2-3 months, but exactly the proper data is not with us.
Yes.
And also, if there is a transmission, if there is a spread in the community, it's already spreading, then that can may develop a herd immunity in most of the Indians, and that is related to our genes.
Right.
And that might help. We are not sure, but that can give a herd immunity to the Indians.
Right. So I think a lot of it is still, yes.
Yeah. I'd like to add, Ashika, a few things to this.
Yes, doctor, go ahead.
There are more than 60 vaccines being investigated under trial across the world. Now, there are certain countries, now this coronavirus has 3 components. One is an RNA and one is a spike protein. So there are spike protein based vaccines, there are RNA based vaccines. Now, which vaccine will come when, how fast, nobody knows. Now, there are other therapies, and there are some people, there are certain researchers, especially there is a gentleman called Dr. Knut Witkowski from the Rockefeller Institute.
Right.
Now, he basically is against this lockdown business. He says that every respiratory disease has a cycle of 2 weeks. And by 4 weeks, you eradicate this virus completely. He also says that the approach to SARS and MERS was so different. So why is this virus being treated differently?
Right.
So there are, we have to promote, we have to welcome the counterpoint. So he says you should let people mix gradually so that the entire world, say we are 75 to 80% of the people get this virus, develop immunity. There is another Japanese researcher who says that by the end of 3 years, the entire world will be immune to this virus.
All right.
So these are therapies. There are therapies which are going to work on the receptor, the ACE2 receptor. There's a recombinant ACE2 receptor therapy which is being investigated very vigorously. And there is this chloroquine and azithromycin, which is found to be very promising in a recent study in France of 1,061 patients. This chloroquine interferes with the binding of the virus to the tissue, to the ACE2 receptor.
Right.
Similarly, chloroquine, when given with azithromycin, augments each other. The only minus here is that some patients who have a prolonged QT interval on the ECG are at an increased risk of sudden death. That also a small number, not all of them. So this therapy in a developing country like us, and especially in the African countries, chloroquine and azithromycin combination should be further investigated.
All right. Very interesting, Doctor, to have, heard some of those theories and, of course, what the treatment is like. I'd also like to introduce Dr. Sunil Gupta. He's the Managing Director and Diabetologist joining us from Nagpur. Appreciate you, Dr. Gupta, for being with us. If I could just stir the conversation back to what I started off with, which is the issue of ventilators. Now, there has been evidence that has been gathered from Wuhan, from New York, which talks about how ventilators have actually proven to be detrimental to the recovery of the patient. The death rate in a lot of cases, has been very high when it comes to, patients who've been put on ventilators. Dr. Bhagwat, if I could, briefly bring you in on this as well, because, we asked Dr. Ganguly earlier as well, but there are doctors who are trying alternate things. There are patients who are being, put on in different kinds of postures, or oxygen is being supplied through tubes. Do you see a negative correlation between ventilator support for COVID patients?
Yeah, I think it's a very valid point. And I received an email from a friend of mine in England who is a head of anesthesia unit. And he feels that a lot of these countries have been blundering as far as the ventilatory management, especially the PEEP therapy, which is the hallmark of ARDS treatment. ARDS is supposed to be the pathology in COVID lung disease, but it is actually not ARDS. So the PEEP that is being given to these patients is actually detrimental. So what they're saying is that they should be giving low flow oxygen.
Right.
Ventilation to these patients should be atraumatic. Very, very crucial.
All right.
Other thing is, what they're saying is positioning the patient. You should make the position change, especially the proning of the patient.
Right.
Proning of the patient, low flow ventilation with a BiPAP, sometimes with a CPAP is beneficial. Then they're also, what they're saying is that there is microvascular thrombosis in these patients. Because this virus is a large virus.
Right.
Because it is breaking the RBCs. So it forms very large complexes. These large complexes cannot go through small capillaries.
Very, very, very interesting, Doctor, some of those points that you've touched on. But I just want to also bring in a question from our next caller. Baldev is calling from New Delhi. Go ahead.
Hello.
Yes, sir. Go ahead.
No, Doctor, my question is, as we see the data, number of active cases are rising daily in hundreds, whereas the cases that are covered is only in tens or 20s, and deaths are occurring. My question is how a normal person takes in a hospital to recover if he has to recover.
Okay, but Dr. Sunil Gupta is also with us. Dr. Gupta, would you like to take that on, the recovery period?
Yes. This virus course actually starts from maybe, if we say day one of the exposure, it might take from 2 to 7 days that it may remain asymptomatic.
Right.
And maybe after that, in between, you might have a dry cough or you might have fever, which will set in. And then the virus first few days remains in the throat. And then gradually it enters into the lungs. So not only 80% of these patients will not respond, will not need, the course will be very mild. 80% of them will not need any aggressive management, and simple symptomatic measures can help them. They can stay home and they can be treated even at home with quarantine. Now, rest of the 20% of the cases, 15 to 20% of the cases might need hospitalization. Out of them, 2 to 5% of the cases might need a critical care management. Now, depending if the person has a mild to moderate disease, possibly the total course will be up to around 14 days or so. But if the person goes into critical care stage, in that situation, the course may go up to 3 to 6 weeks.
Yes, and I think what a lot of doctors have also been saying is that the time period for recovery depends on your own level of general fitness, your level of immunity, and of course, if you're predisposed, like Dr. Gupta is saying, to another condition, there could be added complications. But that's in a lot of cases. Most people can actually recover from the disease, staying home. They don't even need to be admitted into hospitals. Our next caller, GS Chawla, is joining us from Ludhiana. Go ahead.
Yes, my question is, in Italy, the death rate of corona victim is very high. It is said that it is because they are not subjected to BCG vaccination.
Right.
In India, also those persons who are pre-independence born, they were also not subjected to BCG vaccination. So will it be advisable to conduct the BCG vaccination on them so that the severe impact of corona may be avoided?
All right, BCG vaccination, I think that's, that's been a very interesting question. Dr. Ganguly, would you like to take that on as well? And then Dr. Gupta, we can come back to you. BCG vaccination and the connection with morbidity.
For me, I am not sure about this because we have seen that most of the Indians who have taken BCG vaccination, they have got a cell wall protection from this virus. But exactly the mechanism or the pathophysiology I cannot explain. So I suggest Dr. Gupta.
Right, Dr. Gupta, would you then like to take that on?
Yeah. See, BCG vaccination is basically for tuberculosis prevention. It actually covers only severe form of tuberculosis. And hardly few percentage of the patients get protected. People have a myth, people have a misconception that BCG vaccines, those who have taken BCG vaccine, they are immune to COVID. It is not so.
Okay.
It is that possibly it might give you some extra immunity if you have taken a BCG vaccination.
Right.
And that has been even proved if you just compare the Portugal versus Spain, which is very near to each other.
Right.
The Portugal people have been exposed to BCG vaccine like India. While the Spain, they have not been vaccinated since last many years, almost to few decades.
Right.
And that is why possibly the immunity is less. But this is again just a kind of hypothesis, not necessarily that you will be 100% protected from if you are taken a BCG vaccination.
All right.
But
So
certainly there will be some amount of immunity which might be helping our population because we are vaccinated.
Okay.
Now, Ashika, I'll add a few things here.
Yes, doctor.
See, it is a coincidence that researchers in Australia and elsewhere, especially in Europe, they have found that people who have been vaccinated with BCG, they have done well against COVID-9 or COVID-2. The pure reason is BCG-like vaccines, they enhance the innate immunity of a person. Immunity to new stimuli, antigens. Now, coming to the question of gentlemen, why Italy had so many deaths? Now, Italy had so many deaths because Italy continued to take visitors from Wuhan through direct flights. They never practiced social distancing. And Italy has a very good medical system where there are a large number of elderly people. So these elderly people have not been able to fight this COVID-2, SARS-CoV-2. So basically, immunity against SARS-CoV-2 in this elderly Italian population was lacking.
Right.
And Italy also did not they did not gauge the magnitude of the problem in the initial days.
Right.
And
right.
when they started doing all this, and then there was also a lack of ventilators, lack of PPE.
Yes.
So they had to make a choice.
So a
which
whole host of combination, I think, a whole host of factors definitely. So you can't really compare Italy and India in that sense. But I think the BCG vaccine question is an interesting one, and it has also, the research that we're putting out on our screens also says that mortality rate could be curtailed in certain nations where patients had been given the BCG vaccine. So there's definitely that, but whether it can 100% protect you or not is not for certain. But our next caller, Zahid from Shillong, is dialing in. Go ahead.
Yeah, good evening, Rishika. First of all, I'd like to say your show is awesome and it's just inspired to see you talk. So it's awesome. I'll just go through two very quick questions. The first one being that, if somebody has a persistent cough for a long time, how do you differentiate from the cough that happens due to a virus right now and due to an ongoing cough, like it could be due to an allergy, because that's what most doctors tell me. And the second thing is that, what about the vaccination development process in India? I mean, is it going somewhere? Do we see it going somewhere? Because we've heard about this vaccination development.
Right.
But with respect to India, like where is it happening? I just would like to know, and what is the progress till date?
All right. So two questions there. One, of course, on the race for the vaccination. I think that's dominated everyone's mind. But Dr. Ganguly, would you like to perhaps take the question on, how do you differentiate between a common cold cough versus a cough that, could be related to the coronavirus? We know that the coronavirus cough is a dry cough, but that's just about all we know.
Now, you have to take a proper history, because as we are discussing about coronavirus, cough related to coronavirus. So whoever comes, the first thing, whether this cough is a very short term, there is a history of a very short period, short duration, or it's a long duration.
Right.
So even if it is associated with other features, like initially dry cough, and the fever is most important clinical feature in this coronavirus. So fever with a dry cough, with a recent history of travel, and if there is any associated contacts with someone who has traveled recently, or he is in contacts in some health workers. All these things should matter.
All right. So the whole host of factors, and of course the dry cough, which is what differentiates it. And as far as your question about the vaccination is concerned, doctors have already answered it just a short while ago on the broadcast. I'm afraid we're completely out of time. Big thank you to all the doctors for joining us. With that, it's a wrap on the show. Short break. We'll be back with more on the other side.